Hi, I'm Carrie Med, and this assignment is for Class Sims 440, assignment number 6, Family Support Assessment. When completing a family support assessment on patient Candace Conway and her family, there are several areas of care where community nurse can provide assistance, advocate for the patient and her children, and educate. Subjective data provided by the adult parent Candace was evaluated and identified in 4 sections, 1 for her, 2 for her young children, and 1 for her unborn child. I think it was important to include the unborn child based on the mother's health and depending health of the new baby. Subjective data for Mrs. Conway, she is a single parent mother of 2 small children. She is a current smoker and has a history and is current with drug and alcohol use. She is a victim of domestic violence and lives alone with no family or social support, with the occasional visit from her boyfriend and father of her 2-year-old and current pregnancy. Boyfriend has a history of drug use and abuse, as well as anger issues and stealing. Ms. Conway works part-time and has a limited income, limited resources, with no reliable child support from either father in this situation. Objective data for Ms. Conway notes she has poor nutritional habits with no prenatal care and is a current smoker with no plans to quit. She has no psychosocial support and has no known history of financial support from government agencies such as WIC or SNAP. She is anxious with her history of abuse and fears being homeless due to the minimal financial means that she has. She has a knowledge deficit on her son's behavioral disability and the importance of immunizations and health care for her children. For her unborn child, addressing that child first, subjective data would be that it's a 24-week gestation fetus with no prenatal care. Objectively, mother has poor nutrition, which affects the baby, and without prenatal care, this indicates the likelihood of no prenatal vitamins as well. Infant is at a high risk factor for preterm labor due to mother's smoking and drug use and ETOH abuse, which is alcohol abuse. Additionally, caregiving needs for afterbirth are undetermined and are cause for concern. Both children have similar subjective data that include their lack of immunization updates and physical health assessments. Objectively, they're both malnourished. They both lack proper area for physical activities due to living in an apartment with no yard in the middle of the city. They're at higher risk for disease and infection due to having no immunizations or not current. Although the 6-year-old son has playtime with children his age at school, subjectively, the 2-year-old daughter does not have social or development interactions with children her age, which are important. A nursing diagnosis for the 2-year-old daughter would be an increased risk of failure to thrive related to poor nutrition, food deficit in the home, lack of physical activity, and limited health care. A community health nursing diagnosis would be an increased risk of preterm labor and pregnancy or pregnant mothers related to a lack of prenatal care as evidenced by poor nutrition, no healthcare provider for pregnancy, and the use of cigarettes, drugs, and alcohol during her pregnancy. There are several areas that could be focused on for this family and their plan of care. Today we're going to focus on prenatal care, nutrition, and education and immunizations. 3 SMART goals have been identified and the rationale have been identified for this focus. That includes the first SMART goal: mother will have a prenatal appointment through a local women's clinic completed within 2 weeks to evaluate the health of her unborn infant and determine if there is evidence of preterm labor or potential complications due to her high-risk factors. The earlier an infant is born, the higher the risk of death or disabilities. Preterm infants are those that are born less than 37 weeks. They're almost always cared for in a neonatal intensive care unit and face the risk of respiratory distress syndrome, digestive issues such as necrotizing endocolitis, which is also known as NEC, bleeding on the brain, and long-term physical and developmental delays or health complications. The second SMART goal with rationale would be mother will engage in government assistance for nutritional support from WIC for herself, her 2-year-old daughter, and her unborn baby within 2 weeks to obtain nutritional support. She will also attend a nutritional class that is free and required through WIC. The federal government program WIC supports approximately half of all of the infants born in the United States each year. And they are an active resource that provides education and training to mothers that are pregnant or have small children under the age of 5 years old. They also offer nutritional classes and support. They provide education on breastfeeding and smoking cessation, to name just a few of the other areas of care and education they provide. The third SMART goal with rationale would be the children will be scheduled within 3 weeks to have a healthcare visit and for annual physical. This will also include nutritional evaluation, updated immunization plan, and any potential healthcare needs that may arise during that visit. The rationale for this is with a focus on vaccines. Vaccines prevent children from getting a serious number of diseases that can result in impaired health and even death. Diseases such as measles and even meningitis. The provider or pediatrician can assist in ensuring that the children are vaccinated, in addition to applying a catch-up plan for those immunizations that they're behind on. To evaluate how effective the SMART goals are for this family, we'll have to follow up with another appointment or phone call to determine if they were completed. This includes ensuring that the mother was accommodated for initial pregnancy appointment with a local women's clinic to assess her health and that of the unborn baby. Ms. Conway will need to provide dates on follow-up appointments, which she's going to have, being already 6 months along, and any necessary tests or labs that she's going to need to have completed for her and the infant. Ms. Conway will need to confirm when her appointment with WIC was completed and that she has all of the necessary documentation and education on how to use the service. Determine if she has additional questions regarding the nutritional class that she's required to complete. It will be important to offer continued support. A lot of times moms go into these classes, they're trying to manage their smaller children that are with them, and they may not always have the ability or feel comfortable asking additional questions when they're in class. So following up with that and making sure she understands the importance of what she's doing and the food she's providing to her family and their benefit is going to be important. Finally, reaching out to Ms. Conway after 3 weeks to ensure that the children were taken in for their annual assessments and that a catch-up plan has been started for their vaccinations. It will determine the efficacy of that goal. Educating her on providing a copy of current immunizations to her son's school will also be necessary, along with confirming any follow-up appointments that they may be recommended or scheduled for her children. With him going in for an annual health care visit, there may be other areas that they need to look at, such as hearing, growth, her son's behavioral disabilities. So there's other things that may come or arise from that visit that we need to follow up on. Overall, Ms. Conway and her family have several areas to work on for improved health, safety, and education. These areas discussed are just a few that her family can begin to focus on in order to improve the overall health of her family. Thank you for taking the time to watch my video.